You are watching the Doctalk show.
I want to pose a question to our eye specialist right here. How often should someone go for an eye checkup? I know a number of you people at home might have taken years and years without visiting an eye doctor, but is it really important to visit an eye doctor? So maybe we'll start with Dr. Salih. What is your take on this? How often should people come to the hospital to see an eye doctor specifically?
Let's say at least once a year, someone should do an eye checkup. But there are those who have risk factors, like the diabetics. If you have family history of glaucoma, a blinding disease, you may need to come in at least twice in a year, or you follow the doctor's appointments. Of course, if you have glasses, you still follow the doctor's appointments on coming back for check. If you are an adult and you're driving, before you get your driver's permit, please have your eyes checked. Don't sign those forms without your eyes being checked, because then we shall catch people with glaucoma and other problems through that. And every time you renew your permit, that's after 3 years, you should have another eye checkup. So those are the points where we can get problems early that could cause you blindness.
Are there specific conditions which you are worried about, that if people don't do eye checkups, it can maybe start slowly, and the person doesn't know, and then suddenly they become blind?
Yes, one of them is diabetes, as we emphasize all the time, and the other is glaucoma. Because with glaucoma, there's an increase in pressure in the eyes, and this knocks off the optic nerve. Once that optic nerve is knocked off, like you get a stroke, it can't recover.
So that too much pressure in the eye, like the eye is going to burst?
And it slowly,
can it burst?
It wouldn't, but it would spoil the structures.
It would spoil
inside,
the structures,
it
okay.
wouldn't burst. But in a child, yes, talk about bursting. In a child, that eye becomes bigger. And that's how we tell that a child has glaucoma. But for an adult, that eye will not change in size. But it will knock off your optic nerves.
Do they feel, will the eye become red? What will they feel?
The problem is that it's painless.
Doesn't pain?
By the time you come to us, usually it's late, both for the diabetes and the glaucoma, because the diabetes also does a lot of damage inside the eye. That may be irreversible, apart from the cataract.
I think to add to what Dr. Sali has said, that these conditions affect the back of the eye, so they can't be seen. You know, there are two types of conditions: the conditions that affect the front of the eye, as we know clinically, and the ones that affect the back of the eye. And the ones that affect the back of the eye require a special examination kit for us to be able even to see them and identify them. And for the patient, they are even much worse because they don't cause any pain, and the kind of vision loss they get is from the outside coming in. So meaning a person will be able to see letters and look straight where they're looking, but yet they're losing what they call the field of vision. So with glaucoma specifically, they lose the field of vision such that they can't see anything that is happening outside the center where they're looking.
They can only see like straight.
Yes.
But this side they can't see.
They can't see. And that is so bad, because for you to walk, there's a level of awareness your brain has about things around you while you're looking at a specific point. And what's even worse is that while you're losing this, it's not as if there's blackness here, you may be aware of it. The brain fills that gap with what it feels you should be seeing. So it's not accurate, but it's some information anyway, and you're fooled into thinking that you're actually doing what? You're actually seeing. It's only the eye checkups that can help us identify some of these things. And again, unfortunately for glaucoma, it's an irreversible condition. So when we capture you with the blindness coming from that, we cannot take you backwards. So the visual loss is almost permanent.
Almost permanent. So then in that case, if it's permanent, so why should people go for it?
Because we can stop it where it is.
You can stop it, but you can't
We cannot
make
take
it go back.
Maybe in
reverse.
children,
Can be
except in
familiar.
children. In children, it's likely that they can reverse some of the vision loss, but in adults, it's
So it is just to stop the disease progression.
yes.
And it can run in families. So if you catch you early, we may prevent your
Other people in
damage.
the family. That is so true.
Very interesting. So there are some eye conditions which can only be detected if you visit an eye doctor. So you better make that appointment, make it as soon as possible. Call your immediate eye doctor and book an appointment to have a check, at least for effects like diabetes or glaucoma, which can cause painless blindness. So it means your eyes are slowly dying, but you don't feel any pain whatsoever. So At the end of the day, if you over delay, you end up being totally blind and nothing can be done to stop it. So any last, any final messages,
I think I
any
would
key messages
also
people
like
should...
to add other risk groups that need more frequent eye checkups, people with low immunity, because there's certain eye diseases that affect people who have low immunity.
Like what do you mean low immunity? Like which people?
I would, the most common is HIV. I didn't want to point fingers, but HIV, but any other cause of low immunity, really, if you're on steroid medication, steroids are very important. If you're on steroid medication, steroids also affect the eye, they cause glaucoma.
And you know many people use the bleach a lot these days. And there's bleaching
Yeah,
things, they
they
have
cause
steroids,
they
even
cause-
asthmatics.
yeah.
So they should also get regular eye checkups.
Yeah, they cause glaucoma, steroids cause cataracts. Then if you're hypertensive people tend to also have higher pressures in the eye. The pressure in the eye is different from the pressure of the body. It's not the same thing. It doesn't mean when you have pressure of the body. But there's been studies that have shown that if you have high blood pressure normally, there's a likelihood that even your eye pressure is also high. Then
Interesting. Okay.
there are categories of people who have had previous surgery. Of course, you're following doctor's appointments, but it's also good for you to have frequent reviews. I mean, at least 2 times a year, have your eye checked up. For whatever reason, you had your surgery done. If you can, at least once in a month, check each eye against the other, because one eye may not be performing well, and the brain compensates using the other, and you're not aware.
So like how do you check? How can you have
Just
those
closing one eye
checks?
and looking with this one and seeing whether the visibility
If
is
they're
the
the
same. Yes,
same.
because we've had people who come to the clinic, they're blind in one eye completely, using one eye. They don't know how long that has been. They've never known that they're actually blind in a single eye, but the eye structurally looks very fine.
Very interesting. So how can the mothers know that this child maybe has, maybe needs glasses, or maybe the pressure is increasing? How can they know? Yes.
When a child is born, they are not seeing. This vision develops slowly as they grow. The first 6 weeks of life are very, very critical. This vision is developing very, very fast. And anything that prevents this child from seeing, it could be a refractive error, as we've said, it could be a cataract, it could be even a ptosis, that this lid is not opening. Anything that prevents light from entering that eye will cause problems later in life. So at about 6 weeks, this child should be able to start seeing, and should be able to see the mother's face, to recognize the mother, to smile, and later starts doing so many other things. If a child is not crawling, not picking on objects, we suspect that this child is not seeing. And mothers are very quick at seeing this, and they come in and say, I think this child does not see well. When a child gets brain damage at birth, they tend to get visual loss.
So they won't be able to recognize the mother, to pick things. Okay, so that can be the only way to tell.
To tell at that point, yes. To follow any light. At that point, it may be the only way to tell. Then later, we have other methods of telling whether this child is able to see. When they get to the school, they sit very close to the chalkboard or the blackboard, and the teachers usually tell us, Sonomwana prefers to sit very close
or
to
maybe even sitting near the TV.
the
No children like sitting near
the
the
parents
TV.
just say, move away, yet it's a problem.
Okay.
It will spoil your eyes.
Yet actually they're
it's
not seeing.
They're not seeing quite
So such
well.
children should be taken
Should be
quickly to the
taken
eye doctor.
To the eye doctors. Sometimes children are born with a lot of pus in the eyes. We call it neonatal conjunctivitis.
From the, is it from the syphilis? I think one of those
from the,
STDs.
Whatever.
Gonorrhea.
Yeah.
It's gonococcal. I'm not saying that the bowel does not necessarily have gonorrhea, but the agent is gonococcal. The bacteria is there in the back.
Okay, but there are some some infections in the
that
birth canal which are not
injure the child's
treated.
eye. Yes.
Okay.
So if you see a lot of pus in the child's eye, don't put urine, don't put breast milk. You come to us, yeah. Come to us because these eyes can perforate, can burst, and you come and we can't do much due to that infection, yeah. So the mothers should also be able to feed these children well, to breastfeed, to give when they start weaning green leafy vegetables and all, and also to immunize. Because if these children get measles, they can get blind.
Even the rubella, which almost raised a lot of controversy, yet can actually cause blindness.
True, you can. These days now we have the vaccine, yeah. So we have to immunize against rubella, against measles, against everything else, because they get even vitamin A supplementations that help protect the eyes as they grow. So all these things the mothers should know, but especially we should emphasize that they don't use traditional eye medications or traditional home remedies to treat even breast milk, Nalongo's urine, so many other things they put on the eyes.
But while that is being said, we also have to be aware that the refractive errors are the biggest cause of visual impairment. A lot of people,
when you need the glasses.
yes, when you need the glasses, a lot of people are moving around with the refractive errors. They're not aware that they have these errors. But I want to take us back down to this issue we talked about, driving. The fact that I think probably, no one should quote me on this, but probably 70% or 80% of the drivers get their permits without getting any form of examination. They're out on the roads, but yet there's supposed to be a cutoff of vision for you to be able to drive safely. And I remember the permanent secretary talked about this at the last breakfast meeting we had in October, about how we need to revive the policy and try and get this thing to follow through, to get people's eyes checked. Because when you're driving and you are not seeing clearly, you are a hazard to both yourself and to other people who have, yes,
yeah, to everyone.
So you are a danger to society and also to yourself. And I also want to remind people that you can drive with one eye, so you don't have to be afraid that, you know, I think because I have one eye, I'm going to hide this, I don't want to do this test. Even it's possible for you to drive with what? With one eye. If you've had any kind of injury or problem with your eye, come and let's get it treated. If you're going to be left with one eye, you can wear protective glasses to protect the only eye that you have, but you can still manage most of the tasks in daily life, including driving.
All right, quite an interesting perception. So you're saying every driver should have, I think it's a must, it should be kind of a legal thing, that every driver, whoever is behind the wheel on a motorcycle, you must go get your eye checked. And if your eyes are deemed unfit for the road, please do not drive and cause accidents and increase the death toll and increase the statistics of death in the country. So I want to thank you very much, Dr. Sali and Dr. Erima, for giving us this talk on eye care. I think some of the main messages you have highlighted, the importance of immunization. So do not neglect the rubella vaccines, because these infections do cause blindness. Make sure you go for your eye check, especially if you're a driver. You must have a routine eye check every year, once every year. People like us who wear glasses, they do not cause blindness, but you should still go and get your eyes checked and reviewed to see whether you still need the glasses or maybe they change the glasses. So thank you very much. We hope you've enjoyed the show. We'll see you next time on the Doctalk Show. Don't forget to send in your questions and comments on our social media platforms, like our pages, Facebook, Twitter, and YouTube. We'll be so happy to hear from you. Till next time, goodbye.